Welcome to this brief video on the Chinese herbal formula called Generate the Pulse Powder, or Sheng Mai San in Chinese. Classically, this formula is presented as a powder, but in modern China, it is administered either as a prepared liquid, a decoction, or in the case of more seriously ill patients, as an intravenous drip. The formula tonifies qi and generates fluids while stopping excessive perspiration, and as its name suggests, it can be used in a number of acute situations, specifically severe bronchitis or coronary diseases. This formula was introduced by Li Dongyuan in his book Clarifying Doubts about Damage from Internal and External Causes. Li Dongyuan was the founder of the spleen and stomach school in the Jinyuan period. In general terms, the formula is classified as a qi tonifying formula. The formula's name means that it will help generate a pulse, and thus implies that the intended patient has a very weak pulse to start with. The pulse reading is thus a key part of the diagnosis for the original formula. As the formula generates fluids, we can compare it to another yin-generating formula, Liu Wei Di Huang Wan, which I covered in another video. Sheng Mai San is a much simpler formula than Liu Wei Di Huang Wan, although some of their actions are similar. Liu Wei Di Huang Wan supplements yin and sends qi downwards through its draining herbs. Sheng Mai San is focused on tonifying qi and generating fluids by supplementing yin. If we look at the ingredients in more detail, we see that Sheng Mai San is mainly intended for use in more acute situations, whereas Liu Wei Di Huang Wan can be used for chronic issues. With some minor changes, Sheng Mai San can also be adapted for chronic use. In this way, both formulas can be used as adjuvant treatment in chemotherapy. Sheng Mai San consists of 3 herbs: renshen or ginseng root, mai men dong or Ophiopogon tuber, and wu weizi or schisandra fruit. Renshen is ginseng root, probably the most famous and perhaps most misunderstood Chinese herb. It is sweet, slightly bitter and slightly warm, and is associated with the lungs and the spleen. The 5 transformation theory links its sweet nature to the spleen. It is said to powerfully tonify yuan or primordial qi, restoring a pulse which may be on the verge of expiring. It supplements the spleen and boosts the lungs, and promotes fluids and nourishes the blood. It calms the spirit and sharpens the mind. Although renshen is described only as being slightly warm, it encourages internal fire and can have an agitative effect. You should avoid taking coffee and other stimulants when you use renshen, and long-term use can lead to hypertension. It has also been observed to potentially contribute to the retention of a pathogen, and I will comment on that further later. Mai men dong is Ophiopogon tuber. It is sweet, slightly bitter and slightly cold. It is associated with the heart, lung and stomach channels. Mai men dong enriches yin and moistens the lungs. It benefits the stomach, generates fluids, clears the heart, and eliminates irritability. Care should be taken if there is spleen deficiency or deficiency cold. Wu weizi literally means the fruit of 5 tastes, as it was claimed that you could detect all 5 tastes in the fruit. Wu weizi is schisandra fruit. Its properties are focused on its sour and sweet tastes and its warmth. Wu weizi contains leakage of lung qi, reinforces qi and generates fluids. It enriches the kidneys, stops diarrhea, nourishes the liver and quiets the heart. It should be avoided if external pathogens have not been cleared, and if there is excess internal heat. This formula treats patients whose chronic cough is damaging their lungs, resulting in deficient Qi and Yin. Classically, it's called a warm heat or summer heat Qi consumption and Yin damage pattern. We can perhaps recognize this pattern in a number of bronchial disorders. The signs and symptoms are a chronic cough with little sputum, shortness of breath, spontaneous sweating, a dry mouth and tongue. The tongue will be pale red, with a dry, thin coating, and a deficient rapid or deficient thin pulse. If we look at a summary of the herbs, we can see that all three herbs treat the lungs, which are an important source of post-heaven Qi. There is a strong emphasis on boosting Qi, especially with the use of Renshen. All three herbs contribute to the generation of fluids, and Mai Mendong is especially important for this purpose. What may appear surprising is that the formula is also used in cases of coronary disease. This formula is often used when a patient is in critical condition. As such, it is normally understood that other formulas have been used previously to treat the specific Xie Qi. This is important, as one of the characteristics of Renshen is that it can help retain a pathogen, and so the pathogen needs to be removed beforehand. Use of this formula is identified by its signs and symptoms, and these can just as often occur with coronary disease as with bronchial disease. I would like to add a couple of words on the use of Renshen or ginseng. Ginseng has acquired a mythical status in the West as a wonder herb that's great for energy and longevity. Its use for a person who is expiring does not correspond with its use for a person in a less dire situation. In the latter case, it could act more as an irritant. A crude analogy would be the use of kerosene in a diesel engine. It would be helpful for starting it up in certain situations, but would not be efficient or ideal in the longer term. It's important to note that in earlier times all herbs were wildcrafted, while in modern times they are almost exclusively cultivated. Wildcrafted herbs are much more powerful, but obviously more difficult to find. An interesting way of viewing the difference can be seen in the example of the silver fox. The fur of the wild silver fox is highly prized. An entrepreneur set about domesticating the silver fox to try to farm the animal for fur. As you can see from this slide, within a few generations, the quality of the fur degraded considerably. As good quality Renshen is expensive in China, a number of substitutes are often prescribed by Chinese physicians, and in certain cases they may be more appropriate. I summarize the properties of Dangshen and Xiyangshen here. In this formula, Xiyangshen, or American ginseng, is a particularly useful substitute as it nourishes yin and promotes fluid generation, in addition to its qi tonifying properties. If the formula is being used for a critical condition, no substitute should be used for Renshen. However, Sheng Mai San may be used as an adjuvant for chemotherapy, when Xiyangshen is substituted for Renshen. Side effects of chemotherapy include general weakness and dryness, and in this form the formula becomes more mild and can be appropriate for such treatment. This formula should not be used when there is high fever or if the pathogenic influence has not been treated. Here is a final summary of the properties of Sheng Mai San. Thank you for watching this video, and I hope you'll join me for future videos in this series.